Hello, everybody. Welcome to T1TV. I am your host, Asha Brown, and today we have a very awesome and wonderful guest. We have Dr. Jody Stanislaw. She earned her doctorate in naturopathic medicine at the nation's premier holistic medical school in Seattle in 2007, and Dr. Jody treats today's most common health issues using natural remedies with a focus on type 1 diabetes, as she's had it herself since 1980. She works with patients all over the country virtually via phone, and her most popular program is her Easy Lifestyle Transformation Program, which allows patients to feel better than they ever thought possible. She's fun and energetic and loves helping people not only get healthy, but to feel happy and awesome. So with that, Dr. Jody, thank you so much for being here today.
Well, thanks so much for having me, Asha. This is great. I love how you and I are so dedicated to making a difference in the diabetes world. It's a great thing.
It is a great thing, and you know, it's people like us. I'll put myself and you on a pedestal. It's people like us who are getting out there and you know, trying to make a difference in a slightly more unique vein than someone just continuously looking for the right, most empathetic endocrinologist. Because I think you would agree with this that. Sometimes for type 1 diabetics, you need to be your own advocate, and you need to kind of find the resources that are really going to help you, and they may not always be at the clinic.
I think you and I have experienced that firsthand. I went to doctor's appointments for years and years and years, and it is such a unique disease state that if you don't have it, you're never going to get it. I mean, maybe some spouses get it, and you know, there's a few that non-diabetics that I've met who do really get it, but there's just, I was frustrated. I never wanted to go talk to another person about diabetes unless they had it, and I was like, I'm done. I'm done with everybody unless you have diabetes. I don't want to talk to you.
You know, I feel very similarly, and I bet everyone watching this is like, yep. I mean, I think it's exhausting to talk to people about the details of T1D when they just don't get it, because then they ask other stupid questions that, you know, if they were type 1 themselves, they wouldn't be asking. You know, it gets very complicated, and I think that's one of the great things about connecting to people like you is that we're meeting and working with other type 1s who are moving into professions that help other type 1s, you know. So with your services that you provide, you have the perfect accessibility, you know, to be reaching type 1s who have not found any sort of provider that actually understands what they're going through.
Well, so, I mean, today you and I mean, look, we get to chat with everybody online, and I grew up, I think I knew one diabetic for 10 years. Now I know 100.
Yeah.
It's just what a gift this whole internet world is for us. It's awesome.
I totally agree. You know, I said to my husband the other day, I said, you know, I only have like 2 friends that don't have type 1 diabetes now. And he's like, I know, it's kind of weird. So he's just surrounded by them all the time.
Yeah.
But with that, let's talk a little bit about the topic of this little chat today, the essentials of exceptional diabetes care. Could you explain a little bit more what you think are the essentials of exceptional diabetes care?
Excellent. Yes, I'm happy to. We all know that a good hemoglobin A1C is important. I mean, that is important. And when people call me and you know, have phone call appointments with me, the first thing I ask is, what's your hemoglobin A1C? Because if you don't have a good hemoglobin A1C, then we've got to focus on that, because I want you to feel great now, and I want you to feel great into the future. And I'm so sensitive now with my blood sugar levels that if I'm above 140, I'm cranky, I'm tired. I mean, you can't be above 150 all the time and be a happy person. It's just impossible, you know. And I always make the analogy of, like, I just get irritated. I feel like I have so much sugar already irritating me that I can't handle anybody else, you know. And so the first thing, of course, as everybody knows, is good hemoglobin A1C. However, that's where a lot of care stops, and there's so much more. There's so much more. So as you know, and as your expertise is, how's your relationship with food? You know, you can have a perfect A1C, but you can be completely freaked out about every single piece of food you eat. Maybe you have a great hemoglobin A1C because you don't eat. you know?
Yes,
So
totally.
yeah. So there's 4 particular areas that I always ask my patients about. And the first question is hemoglobin A1C, but then there's 4 other areas that, frankly, now my CGM's beeping at me. Sorry.
Oh,
I
it's
think,
fun.
I
It's
think
fun.
I think
Well, you check that. I'll just say that last night when I was, oh dear. Do you have I wish I could give you my glucose tabs. I could just hand them over to you.
I got my.
Well, you drink your juice, and I'll just mention I did DMSA last night, diabetes social media advocacy last night with Scott and Charisse. And at the beginning, Scott and Charisse were like, "Oh yeah, my arrows are going down. I'm gonna get a little low through this." And I was like, "That's fine, guys. I'll just talk for hours. You know me. You guys treat your low. I'll just keep talking." But halfway through, I looked at my CGM, and I was like 65 with a diagonal arrow down. So then I was drinking juice and trying to talk. We were all low through the show. And honestly, I don't remember exactly what I was even saying at some points, because when you're low and then your head gets really hollow and you're like, I don't know what I'm saying, but I'm going to keep talking. So
yeah,
there you go. It just happens. It happens. But yes, yeah. So if you want to continue, feel free, because I think it would really be interesting to hear about your four components that move beyond just the A1C, into other areas that are critical.
Yeah, and the cool thing is I work with a lot of patients that are diabetic, but I also work with a lot of patients that aren't, because these 4 areas are key areas in your life that really establish health and well-being for everybody. And so the four components are food, not only what you're eating, but of course your emotional relationship with food, because both are huge. Exercise, because it is the most powerful medicine on the planet, and I'm sorry if you don't like it or if you love it, but we got to talk about it, because your body's meant to move. And sleep, because it's awesome.
Yes, it really is. And our culture does not, there's articles, are you sleeping enough, but no one actually honors the need for everyone to have enough sleep.
Yeah.
Yeah. Everyone's like, I stayed up all night. I'm waking up early. I'm just going to, not sleep until I die.
Yeah, it's medicine. It is medicine. So all 4 of these areas are medicine. And then, of course, the 4th one is just overall emotional well-being, how well you like your life, how well you like yourself, how well you deal with stress, how happy you are. So I had an office where I saw patients like a typical doctor, where it was just one appointment, and it left me feeling so frustrated, because I could see how much, someone would come to me for because they had a cold or a flu or runny nose, and they wanted it to stop, right? Well, they had colds and flus because they ate like crap, they didn't sleep, they didn't exercise, and they were stressed all the time. So I felt really empty helping them, with their runny nose, when actually what was going on is these 4 areas weren't strong. And I saw that in hundreds of patients. I'm like, look, at this doctor's appointment format is not working for me. And so now I do consultations with people all over the country on the phone, and I have this 3-month program, which you mentioned. It's called the E.A.S.Y Lifestyle Transformation Program. And E.A.S.Y is my acronym for those 4 things: eating, activity, sleep, and you. And so essentials of diabetes care is really having a good A1C, but also feeling strong about all 4 of these areas. And frankly, everybody needs support in those. Even if they're kind of okay, we can all be better in those 4 areas. So I've created a program where people's lives totally transform, because it's all about simple. That's why it's called the E.A.S.Y Lifestyle Transformation, because we're too overwhelmed to do anything overwhelming. Like, I'm not going to tell you to never eat sugar again and exercise every day, because as soon as I tell you that, I want to go eat McDonald's and sit on the couch. It's just that rebel in me, and I know there's a rebel in everybody. So,
yeah.
So I'm really passionate about helping people get the support they need to feel awesome in all 4 of these areas, plus a good hemoglobin A1C.
Wow, that is so exciting. And what I like is that just what you mentioned at the end, this isn't like on The Biggest Loser, where these people leave their entire lives and go away in a weird environment, you know, where everything's perfect, and then they, you know, fix everything that's wrong with them. And, you know, for The Biggest Loser, it's all about weight loss. It's not really about what you're talking about, but the same concept applies. So your program helps people integrate new concepts, new habits into the life they already have, perhaps taking a new perspective on, you know, things that they could change about their life if it's not making them happy. And I think that's such an amazing tool to offer and for people to be able to access.
I think it's an incredibly unique offering because I'm a physician, I'm a diabetic, I'm very accessible. You can call, I mean, we have a call once a week, but you can, you know, text me or email me. Like, we need support, and that's what I never felt like I got. You know, I need support. I don't want you to say you're doing great, I'll see you in a year, or I'll see you in 6 months. It made me feel lonely. And so all the things that I never found is why I've created this program, because
that's so awesome.
You know, I am there for my patient in whatever way they need for 3 months. And a lot of people will sign up and keep going after 3 months because they feel so awesome. You know,
that's really good to know that you can re-sign up if you want to keep going and keep working on stuff. I think the other thing, too, is that to me it sounds like you are happier with your life now that you've made this transition. You know, I know a lot of providers who work in the clinical atmosphere, and you feel really stunted as to how to actually help people because there's lots of red tape and lots of rules, and now it's on your ground and on your schedule, and that probably makes your life, you know, your personal life and your emotional life a lot more fulfilled.
It's fun. I don't have any employees. I have a few business partners that I bounce ideas off of, but it's just me. I run my own show. And frankly, when I talk to patients, it's got to be a win-win. It's like, I got to like you and you got to like me because we're going to work together a lot for the next 3 months. And but, you know, sometimes I talk to people and they're doing great. You know, they're eating well, they're exercising, but they just have a few, you know, like a few tweaks they want to make to their diabetes. And so I do offer smaller, like I offer a bundle of like 3 appointments. People can work with me just in a bundle of 3 appointments. So it doesn't have to be an intensive 3-month program, but my passion is giving people whatever they need. And sometimes people will start going into, like, I have this diabetic right now, and she's like, Jody, I don't want to talk about diabetes at all. She goes, I had a blow up with my husband, I had a blow up at work, I'm doing horrible. And so the whole appointment was I put my therapist hat on, and I love wearing the therapist hat. I'm good at it. I love doing it. So I wear many hats. I wear the nutritionist hat. I wear the cheerleader's hat. I understand. I struggled with my diabetes, with my eating disorder for so many years. I get that, you know.
Well, and that's kind of what I wanted to, I want to make sure that we go into that because, first of all, when you say you wear so many hats, I have this little image of you with this, like, trunk, you know, from the olden days, and you've just got a bunch of hats, and you're like, okay, let's put this one on, let's put this one on. And I really empathize with that, too. I mean, I'm not at all a doctor, but it's interesting how, depending on each person you're working with, you can sense what they need and, you know, put on that hat for, you know, to be that right tool for them. But one thing I wanted to make sure we discuss in this is how you do have a history with an eating disorder, and it's really wonderful that you're so open about it, and really important, I think, to your care, and also to show that you have a great deal of perspective from where you have been to where you are now with your diabetes care and your embracing of a better lifestyle.
Yeah. So do you want me to tell you a little bit about my history?
Yeah, I'd love to hear a little bit for everyone to be able to kind of know, as much as you want to share.
Oh, I share anything.
I know. You and me are the same. Yeah. We'll just stand in an empty room and talk about it.
Yeah. Oh, yeah, all those years I used to throw up all the time, you know, whatever. So, I got diagnosed when I was 7, and back then there was no such thing as a sliding scale. You were just told what you had to eat at what time, and you had to weigh and measure everything. So I had to weigh and measure my breakfast at 8 a.m., weigh and measure my lunch at noon, and if dinner was at 7, I would eat at 6 because I couldn't wait till 7. Because back then, the insulins there was no such thing as fast acting. It's like you did your shot at 9, and that kind of set you up for the day. So you had to eat at noon and 6, and that's it.
Right.
I was really kind of a high achieving, perfectionist kid who wanted to try to make everybody in the world happy, which ironically I'm now a doctor, but whatever. We all
comes full circle.
Yeah, we all use our childhood wins to there's a positive side, right? My role in the family was to try to make everyone happy. That was the role I took on. So I never really had a big rebellion stage in terms of my diabetes. But behind closed doors, I would binge a lot on sugar because every time I went to a friend's house and I'd have a sleepover, I would go to the cookie jar because it was, you're a little kid and you're like, oh, it's so bad. And we didn't have any at my house. So
you never got to indulge.
Yeah. So I really, and then at Grandma's house, I always knew where Grandma's ice cream was and her granola and all of that stuff. So I started going to a therapist when I was 14 because I kept telling my mom, I'm like, Mom, I just keep thinking about food all the time, and then I binge, and sometimes I'll binge after dinner. And back then, it was just a weird behavior. I didn't know anything about anger or rebellion or emotional, the need to eat out of emotional pain. But the other thing that nobody told me about is when you're low, you want to binge. And personally, when I'm high, I want to binge.
Yep. I think it's very, very common. I think a lot of people are nodding their heads with that.
Yeah, and nobody told me that. Nobody said, they said if you feel low, you eat 15 grams of carb. Well, when I was low, I wanted to eat 1,500 grams of carb. Right. And I thought something was wrong with me. Nobody told me that was normal, And so, and when I was high, I'm like, well, this is horrible. I'd have, dinner, and then I'd probably be over 200 after dinner, and then I'd go sneak in the kitchen and eat more because I was dying to eat more. And I was thinking, oh my God, what is wrong with me? Again, nobody told me that fluctuating sugar levels makes you want to binge,
Well, so they still don't talk about this as much as they should, but amylin, the hormone that we don't have as type 1 diabetics, finally Simlin came out, I think it was 2005 or 2006, and I finally was offered it, and I was like, well, look at this. Who knew that I didn't even have this hormone in my body? No wonder I was always hungry and binging and had an eating disorder. I mean, God, nobody tells you anything. So it's,
It's complicated. Well, and so then I'm a female. I want to be skinny, and then, my parents are gone a lot, so I'm feeling lonely. So I want, so there's all these non-diabetic food issues going on too, And it was awful because I used food to comfort myself and to rebel, but then I wanted to be thin, so then I was like, well, I shouldn't eat at all. And it was just this constant, like, you need food, don't eat food, you need food, don't eat, So it wasn't, and so then I'd binge, and then the next day I'd work out and try to eat less and work out more and, just be on that roller coaster of like overeating, undereating. And then it wasn't until my 20s that I learned how to throw up. And so then I would throw up every time I'd binge. And that ended me up in a rehab center for 2 months. And, I'm so grateful now, after 35 years of living with diabetes, that I don't feel so much rebellion anymore. Like, being bulimic, I ate so many cookies and so much ice cream that I feel like I kind of got my fill.
Enough for a lifetime. Enough for a lifetime.
And I'm like, and so my whole childhood I wanted a cookie but was told I couldn't. There was no free choice. There was no free will. It was like, no, no, no. So then the bulimia thing was like, yes, yes, yes. And so the pendulum went here, then the pendulum went there. And now finally I'm kind of like, I don't think I want a cookie. Like, I can say that now because I'm like, it's sugar. It's not good for anybody, whether I'm diabetic or not. And I like having good blood sugar levels because I'm a happier person. Because like I said, even if I go up to 140 or 150, I'm not as happy. Right. I'm not as clear-headed. And I'm really proud of how diabetes kind of forces me, you know, to not want to have sugar now. Because I'm like, you can have that sugar and you can feel okay, but we know it's not good for you.
Right, or you can work twice as hard, maybe 3 times as hard to cover that cookie and then deal with the aftermath of your Dexcom being like, woo, you know, I mean, just a lot of work. And yeah. I wonder, too, if the other thing, too, is that you are now more in touch with those emotions you said that you couldn't name as a child. I mean, neither could I. I didn't know why I was binging and restricting and over-exercising, but now you are aware, and your self-awareness helps feed a craving, and you go, oh, but that's really just because I'm feeling this way, and you can make the connection.
And by no means have I got this thing licked. You know, by no means am I like, oh, yeah, food's no problem. I eat perfectly all the time. No.
It's still, you know, and I think that's so brave and honest, and it just makes me respect you more that you share that, because when you have had an eating disorder, you are never like ready to just completely trust everything about food ever again. Even if you're in strong recovery, there's always some feelings that just flutter up out of nowhere, and you're like, whoa, why do I feel so strongly about this cupcake right now? You know, I mean, and they could be very dormant for months, and then all of a sudden you start to feel that anxiety creep up again. And so it is a constant, it's an extra gerbil wheel going in your mind, along with the gerbil wheel of type 1 diabetes, you know, thinking about your recovery and just how to manage it as best you can.
Well, then you throw in some crazy blood sugar levels and all the emotional awareness in the world. You know, I still want to eat the entire grocery store if I'm low and I walk in there.
Right.
I got arrested. I got arrested once in my 20s. I was in the bin section, and I was like eating from all the bins. I was just eating. I was in a low, so I wasn't even thinking about it. You know, I was just like eating. And then I came to kind of like, oh no. And I thought, oh God, I just ate a lot from the bin. So I put a ton of stuff into a bag and went to go pay for it, and then I was going to dump the bag back and empty it back in the bin because I just felt bad, right? And as soon as I went to the cash register, this guy took me to their security room.
Oh my gosh! Did you pull the diabetes card and just say that, oh, I was low, it was a medical emergency, or?
He was not buying it. He wasn't buying it.
Wow.
You know, but you know, part of me feels guilty because, you know, I was aware that I shouldn't do it. I was aware of that, you know, but I kind of felt too weak to stop, you know. But yeah, I
think that you and I both have a lot of memories. I have a, you know, notebook full of things of behaviors I did or choices that I made during my eating disorder that I'm very ashamed of now. You know, I feel like I'm almost a different person now. You know, when you have this very dark fog over you all the time, you know, until you really take a look at it and deal with it, we don't sometimes have the best judgment, you know, or certain things seem less important, you know, because everything is relating to our eating disorder. We don't really have that sense of self-perception or self-awareness.
Well, and the flip side of that is it became normal. You know, binging growing up is like, it's just what I did, you know. I mean, of course, I never did it in public. I always had to, you know, one of the hardest things about being bulimic is figuring out how to throw up with nobody hearing you. You know, but it started, when I lived alone, it was easy, you know, but I mean, I do feel very vulnerable admitting this, but yeah, it got to be, and part of me actually enjoyed it because I could eat anything I wanted and then not worry about my sugar level afterwards. And yeah, it's so complex, but I freaked out once though, and literally thought I had killed myself because I started getting burning in my chest. And you know, you can get so much acid that comes up your esophagus that you can create cancer. You can call this condition called Barrett's esophagitis. And I thought this was it. You know, I've done it for so long. I've made myself get cancer, and you know, your esophagus can burst. You know, and so I went and got an endoscopy, and I thought for sure I was dying. And the endoscopy looked fine. They said fine, but like the sphincter, the muscle at the bottom of the esophagus is weak. It's more open than it should be. And then I thought, oh God, after thinking I would killed myself for so many months, I thought I'd never do it again. I'm like, okay, good. I'm so glad that happened, because now I'm so scared I'll never do it again. But then I did, you know.
I think that message and that story is really powerful to share, because that shows how extreme and how powerful an eating disorder is. Things happen like that, you know, to people who have struggled with it for as many years as you and I have. And, you know, you may get a little scared, but you are so wrapped up in it, and it is so much a part of you that you just keep going and continuing to do those very deadly and damaging behaviors.
Yeah.
You know, it's...
Our minds can justify anything,
yes,
you know?
Exactly.
And I'd say, well, people puke all the time. People get sick. People get food poisoning. I'm like, there's no problem with puking. It's no big deal. One tip that I do want to give, if anybody is struggling with bulimia, is I always would rinse my mouth out with baking powder, because you get so much acid on your teeth that's a huge problem. But the baking powder neutralizes the acid. And interestingly, I went to an eating disorder specialist for help many, many years ago, and she's told me that. She goes, well, if you're going to still throw up, take care of your teeth. And that was one thing. I mean, I'm so grateful. My teeth are perfect. My dentist can't even tell I was bulimic, which is normal, because normally a bulimic's teeth are ruined.
Yeah. You know, one thing, too, is that if someone who's struggling with, you know, traditional bulimia, not diet bulimia, but the act of purging through throwing up, you know, anyone who's watching this, I can think of no better of a transition after seeking treatment at a treatment center than perhaps hooking up with Dr. Jody to start talking about how to rebuild a lifestyle that does not include binging and purging, because you are absolutely, you know, the perfect go-to person specifically for that type of recovery. So, you know, this is a tough subject to talk about, but it has to be done openly, and people have to see people like you and I talking about it to understand that you really can move forward. It doesn't mean everything is magically better, but you move forward and you rebuild your life step by step.
Absolutely. And that's back to my program. I needed a lot of support, and I didn't want it to be once every quarter. And I wanted to talk about food, and I wanted to talk about my emotions. And that's why I created the program I did, because it covers all of those things.
I love that. And really, that's necessary, especially for type 1 diabetics, but really for anyone going through a large health transition or change. You know, it's necessary, and there's really nothing at a clinical level or an official level, you know, offered through large-scale hospitals that can offer that. So for all those reasons, you are a very valuable resource in the T1D and just the naturopathic community.
Yeah. Well, so I'd love to give, if anybody wants to just have a free chat with me, because it's kind of weird, you know, this whole online world and having an appointment with your doctor on the phone. I do free intro consults. So the first call is always free. And all you have to do is go to consultwithdrjody.com. And it's just the word consult, the word with, and then drjody.com. And you'll get a link to my online calendar, and then you can just book a free call. You'll see my calendar there, and yeah, and I hope to continue to keep being able to offer these. I'm getting super busy now. It's awesome, but I'm so casual. I normally can chat with patients however long they want, you know, but right now I'm still offering them. So go to consult with Dr. Jody, and you know, if you have an eating disorder, I can help you. But even if you don't have an eating disorder, you know, I mean, I wear many hats, like we said.
Many, many hats in your big train trunk. Well, and we'll make sure that we get a link to that posted on here at some point, or maybe when the thing is offered on our Google Plus page, we'll make sure that the consult with Dr. Jody is the link is there as well.
Yeah, and then if people want to read more about me, my website, because the consult, there's no other information than just signing up, but my website is just Dr. Jody ND, and so that's DRJODY, and then N as in natural, and then D as in doctor.com. So DRJODYND.com.
Perfect. Great. We'll make sure both those links are available. Well, we better wrap it up. But Jody, thank you so much for being my guest today. It's so good to see you. You know, I'm so glad that we've connected, and you know, I'm sure that this will at least get some interest, and I'm really hoping that some people watching this realize that you know, if they have not found help through a traditional treatment program for bulimia, they have a new resource out there to reach out to. So thank you so much for being here today.
You're so welcome, and I'm so honored to be on your interview. So I appreciate. I'm so glad that we got to connect too.
I know, I am as well. All right, take care, everybody.
Okay, bye.